Hi everyone, Amber Canoy here with Everyday Kentucky. It's our journey around the Bluegrass with Gigi of Aging with Grace. And you always take us to some of the most interesting places. I learn a lot. So
I do too.
Where are we today?
We're at Bluegrass Hearing Clinic in Richmond, Kentucky, and we're here to talk with
Dr. Mary Sohler about hearing, how it ties to all of our health.
Especially for seniors.
DG, I know that you all are really big on maintaining health, right? Trying to sustain that quality of life for as long as possible.
Sure.
When it comes to hearing, what are you seeing that people are probably falling short on a little bit?
Well, one of the biggest things are people sticking things in their ear, not cleaning their ear properly, not getting tested, not having their hearing aids checked. So Dr.
Mary Sohler,
Mary Sohler can...
She can tell us all the real
I
details
tell you
what
all
people are not
about
doing
that.
well.
Just like you want to follow up with your primary care and have regular checks every year, same thing with vision. You want to do the same with your ears. So between 1 to 2 years, you want to have your hearing checked, make sure if anything's changed, we stay on top of that. First thing we do is look at your ears. So if you've got wax in there, we will let you know. Sometimes we can take it out. It kind of depends on what we got going on. If you have something in the ear, we'll let you know too. You just don't want to be putting things in your ears like Q-tips. I know that's hard for people to hear, but
a little hearing aid piece.
Here, every once in a while I get that, yeah.
Right.
Wow.
In which case you want to go see your provider and we got to pick something different. If it's in your ear, it's not the right size.
What about like maintaining if they have hearing aids? I mean, like I would think, I'll just speak from AirPods. You know, like when you're listening to music, those things can get nasty. if you're not
It's just
careful.
like with your teeth, you go back and have that checked every 6 months. We recommend you have your hearing aids checked every 6 months to help keep them well maintained, make sure they're working in tip-top condition. We find that people that have regular maintenance, we don't have as many repairs come up down the road. So
Can you use alcohol to clean that piece that goes in
I
the
would
ear?
not use anything that's wet. I would keep things dry. You just don't want moisture in the hearing aids because that can cause issue with the circuitry. So you want to keep things dry, use like a soft cloth or a tissue. You could even use like a toothbrush and brush off the tip that goes in the ear, brush that wax out of there. You can't hurt anything with a brush. You can't hurt things with moisture.
How are we supposed to clean our ears?
So what you want to do is let the ears do their thing. They're supposed to get the wax out on their own. So as we get older, the cartilage in our skin changes and it's harder for your ears to do that on their own. So for my people that have chronically waxy ears, you actually want to see a professional. I have people go sometimes every 6 months to an ear, nose, and throat doctor, have them really clean it out good. I have a few people go every couple months. They just are wax producers. So
The Q-tip does not go in the ear.
does not go in the ear. I have taken cotton out of people's ears from Q-tips. Do not stick them in your ears. And the outside's okay, just don't put it in there.
Add life to years. A journey around the Bluegrass is brought to you by Aging with Grace.